This is Grace with Graceful Living. Today we have a special episode with Dr. Miki Purnell. She talks about treating chronic pain with diet and lifestyle changes.
Actually, 2 years ago, I got board certified with American Board of Integrative Holistic Medicine. As I began practicing, food is number one medicine, mind-body practice is also medicine, and optimal exercise also serves as medicine. Sleep is our medicine. And how can we medicate our patient with those natural medicine? And I've been always implementing those in the bread and butter family medicine. But then I got invited to join this multidisciplinary pain management team in Hawaii. I visited the clinic and I met the team, and that was exactly what I wanted to do. So their team consists with chiropractor, massage therapist, pain psychologist, and also the interventionist who provide the injection and stuff. And then what they're looking for is whoever practices food as medicine, natural medicine, and implement it, and that was me. So I just decided to follow the life's calling.
Mm-hmm. That's wonderful.
Typically, we do have a lot of population suffering from fibromyalgia, IBS, and chronic abdominal pain, and also post-laminectomy back pain syndrome. So basically, after the surgery, the pain doesn't go away. And multiple of our patients, they were medicated with medication like non-steroidal anti-inflammatory medicine for long term, and anti-acid like proton pump inhibitor for years. After the esophagitis is already treated, then those medications were just put because maybe they didn't tolerate weaning off because the rebound reflux and all that. So many pain is as a manifestation of multi-organ related condition, especially the gastrointestinal condition. And then also when the pain gets so overwhelming, they begin to worry that how come their pain doesn't go away. Then when they become anxious, anger, frustration, then these add additional toxin load to the body, and their sleep get affected. And then when the sleep doesn't function as restoration, then of course the pain continues. So then we combine everything, because any pain initially started as an acute pain as a result of overuse or injury. However, when the tissue heals, pain should go away. So chronic pain by definition is the pain that lasts more than expected tissue recovery time, usually 3 months. Then what's going on in their body is far more complex. So their DNA changes. Then we gotta eliminate and reverse each component that fuels the chronification of the pain. So sleep, obesity, bad diet, and bad emotion, and also the too much or too little activity. And then some pharmaceutical, for example, I was mentioning about like non-steroidal anti-inflammatory. So short term, of course they have its own place, appropriate use is there, but in the setting of the chronic pain, this is definitely not the medication that you wanted to use it for weeks and months. It takes a lot of education to activate everybody. But they're so used to be medicine being done. They don't do the full body analysis, and then they don't have any idea how much of what they're eating, what their sleeps are, what their activities are like. But we do take all this history, then do a good physical exam. So we identify, isolate posture and body mechanics, and also where is the biomechanical pain generator. We isolate that, and then we take care of the medication so that you eliminate the medicine that impede the natural physiology, and then put them on a really good diet, activate them, encourage them.
What specifically do you tell them to stay away from in the diet?
Okay. Sugar, refined flour, and then also the ultra-processed food. Usually the box with the preservatives and food colors, and then also large animal meat, and also even small animal meat, any factory-grown meat, and also meat in itself, even like free-range chicken, organic chicken. There's a study that dioxin was found in free-range chicken eggs, and when they traced it. Where does it come from? It from soil contamination.
So people should just stay away from even this free-range chicken, free-range beef, and
If they can be a vegan, that our research, or all the researches that published out there shows that that's significantly best. And then eventually, you know, I also utilize like a 7-day cleansing detox. And when they do this cleansing, and one of my patients came and spoke with me, and she did this cleansing. And then, okay, she broke the cleansing and go back to the normal diet. She ate the burger, but she couldn't finish that. And then her elimination became super regular. That's first time in her life it became regular. She was so excited. But then after eating this half burger, it stopped. Then she experienced that body change, and then she accepted how our body is being made. Then, you know, the change happened. So there is some pivot point. Our clinical colleagues, they all echo the same messages. So when people hear from just one person, it may not register, but every time they see acupuncturist talks about the diet, and then he even go over the medication with the patient. Then, you know, it's additive, cumulative things. When the education and encouragement get to some pivot point, then they accept. Then they began to implement the changes, and then once they begin changing, it's life changing. And then there are many people who, you know, sometimes send me personal emails saying that, thank you so much, my life is changing. Your team is awesome. That's really good.
That's rewarding.
Yeah. And I think we owe them to share what the evidence is really saying, instead of, you know, bending to what's socially acceptable and all that. So we just tell them, hey, this is the ideal scenario from what's published and what I have read, and then I don't expect you to get there right away, but any changes, you pace yourself how you wanted to implement the change. And then if you run into problem, we crunch our brains, let's find new recipes and, you know, resources. That's how we are working right now. Different people have different food sensitivity. So what I do is, let's try eliminating highly considered antigenic food. You know, they include corn, gluten, soy, dairy, and also the large animal meat, and also processed meat, and then sugar, of course. And then after they do eliminate, like 2 weeks, the day number 15 is a provocation challenge day. So when we eliminate for about 2 to 4 weeks,
you eliminate everything, like all those things.
Yeah, there's
and then the day 15 you do the challenge.
Challenge one food at a time. So day number 15 is the food number 1 you introduce. For example, bread you introduce. And then the day number 16 and 17 is to evaluate your symptoms. So the bloating, elimination, aches and pains, and mood. So the people write down the logs. So some of my patients, they do really diligent logs. So, you know, she showed me what she did, and like, wow, so impressed. So the in her case, the dairy caused the stomach upset, and also gluten caused some aches and pains and some slight swellingness of the fingers. So then, you know, she was able to eliminate that since that on.
Nice.
Yeah.
Thank you, Dr. Purnell, for educating us on how diet and lifestyle changes can be used to treat chronic pain. Dr. Purnell will be speaking on Tuesday, March 14th at the LOI Clubhouse at 7 p.m. if you want to hear more from her. If you like this video, please give me a thumbs up and subscribe. Please go to graceandhawaii.com for more information.